The chemicals are used, for example, in the production of water and oil-resistant clothing, electronics, and non-stick cookware, and people are thought to ingest them as food comes into contact with packaging. The substances are believed to disrupt the function of hormones, signaling compounds that influence many bodily processes. Led by researchers at NYU Grossman School of Medicine, the new study in roughly 5,000 Americans identified 13 medical conditions that may result from PFAS exposure, such as infertility, diabetes, and endometriosis, a painful disorder of the uterus. Our findings add to the substantial and still mounting body of evidence suggesting that exposure to PFAS is harming our health and undermining the economy, says study co-author Linda Kahn, Ph.D., MPH, an assistant professor in the departments of pediatrics and population health at NYU Langone Health. However, the new study, publishing online July 26 in the journal Exposure and Health, incorporates a much broader range of health consequences across the lifespan, says Kahn. For the investigation, the researchers determined how many Americans were likely exposed to PFAS chemicals in 2018 using blood samples obtained from adults and children who participated in the U.S. National Health and Nutrition Examination Survey. Next, the study team analyzed data from dozens of studies in the past decade that explored diseases connected to the substances. The research team used models from earlier investigations to estimate the national economic cost of the medical bills and lost worker productivity that resulted from the top 5 medical conditions that had the strongest links to PFAS exposure. Among the findings, the investigation revealed that childhood obesity was the largest contributor to the overall economic toll of PFAS exposure, costing about $2.7 billion. The study investigators also expanded the scope of their economic estimates to include 8 other conditions with preliminary links to PFAS exposure, including endometriosis, obesity in adults, and pneumonia in children. When such diseases were considered, the total costs reached as high as $63 billion. Our results strongly support the recent decision by the Environmental Protection Agency to lower the safe allowable level of these substances in water, says study senior author Leonardo Trisande, MD, MPP. Based on our estimates, the cost of eradicating contamination and replacing this class of chemical with safer alternatives is ultimately justified when considering the tremendous economic and medical risks of allowing them to persist in the environment. Trisande, the Jim G. Hendrick MD professor. The research team next plans to examine the long-term risks of PFAS, adds Trisande, who also serves as director of NYU Langone's Center for the Investigation of Environmental Hazards. In addition, the study authors plan to estimate the economic burden of other endocrine-disrupting contaminants, such as bisphenols, substances used in many plastics and can linings, fire retardants, and pesticides. He also serves on scientific advisory boards for Beautycounter is Global and Footprint. The terms and conditions of these arrangements are being managed in accordance with the policies of NYU Langone Health. In addition to Kahn and Trisande, Vladislav Obsekov, MD, at the Children's Hospital of Philadelphia, served as the study's first author. Jian-Yan Lin, Rui Xing Yin. Exposure to endocrine-disrupting chemicals and type 2 diabetes mellitus in later life. Exposure and Health, 2022, doi. 10. 1007 per second 12403, 022, 00486-0 NYU Langone Health, NYU Grossman School of Medicine. Exposure to forever chemicals costs US billions in health costs. Science Daily, the 26th of July 2022. ift.tt/J2 Zwaddle. NYU Langone Health, NYU Grossman School of Medicine. 2022, July 26. Exposure to forever chemicals costs US billions in health costs. Science Daily. Retrieved July 26, 2022 from ift.tt/J2 Zwaddle NYU Langone Health, NYU Grossman School of Medicine. Exposure to forever chemicals costs US billions in health costs. Science Daily. ift.tt/J2 Zwaddle. Accessed July 26, 2022. Thanks for watching. Please subscribe my channel for more videos.